Hello, and welcome to a special edition of our Health Go Live webinar series. On today's episode, we will hear from people directly impacted by the war in Ukraine and how we as a health community can step up to provide urgent medical help to those in need. The Q&A feature will be available, so please send in your questions for our panel. Our moderator today is Anna Levchuk. Anna is a member of the Supervisory Board pending confirmation of State Enterprise Medical Procurement of Ukraine. Anna is also Vice President of Product at Clarivate. And with that, I will turn it over to Anna.
Hello, everyone, and thank you for joining this special emergency webinar devoted to connecting the medical and pharmaceutical community with the relevant authorities in Ukraine to coordinate aid efforts. Today is the 8th day of Russian-Ukrainian war. According to BBC Ukraine, over 2,000 civilians were killed since the beginning of the war, and many more were injured. Numbers are impossible to verify. Not a single hospital closed yet, but supplies are starting to dwindle, which is why your help is vital. The goal of this webinar is to connect people willing to help the authorities in Ukraine that have a centralized catalog of needed medicines and supplies. The situation is developing hourly. As I was preparing my notes last night, I learned that President Zelensky created an Office of Coordination for Humanitarian and Social Work. We do not have their contacts yet, but we will continue monitoring these developments. We do have official contacts that we are sharing right now on the screen. We will also distribute those contacts in the post-webinar email. Before we begin, I would like to thank our friends and supporters at Health. They put together this webinar for the people of Ukraine on a very short notice. Thank you, Health, for lending your technology platform, marketing capabilities, and a team of passionate, caring professionals who worked with us. We are very grateful to Jonathan, Richard, Jody, Nicole, and others who worked behind the scenes. In addition, Health is donating $10,000 to 2 Ukrainian charities. Finally, I want to thank LinkedIn team for picking up this webinar and including it into their collection of Ukraine-related resources. Thank you, Lee and Colin. We are operating with increased security precautions today. This means we are not disclosing any locations, logistical routes, personal contact information, or even the list of medications needed. We do have access to this information and will make it available to interested and validated parties. In a minute, I will introduce our panel. They will give us their perspectives on the situation on the ground and their needs. In the meantime, please submit your questions through the chat. We will dedicate the second half of our panel to Q&A. If we won't get to all the questions, we will answer them individually after the event. Before I turn to the panel, I would like Nicole to ask to play the videos pre-recorded by physician working in the Ukrainian city of Sumy. Sumy is an ancient city 30 kilometers away from Ukraine. It has been heavily attacked by the Russian army. It's been shelled and bombed for 8 days in a row. We wanted these physicians to join us today. However, due to the demands of their work, as well as continuous air raids on the city, they are unable to join live. However, we would like you to see their pre-recorded videos and plea for help.
Hello, my name is Nikolayenko Andrei. I am vascular surgeon.
My name is Dmitry Sichnenko. I am vascular surgeon.
My name is Vladimir Bilay. I am vascular surgery.
Hello, my dear friend. We are surgeons from Ukraine. Russian army attacked our country. Part of our country territories are occupied. Ukraine cities bombed. Many civilians died.
Ukrainians continue their work. We provide first aid for Ukrainian and Russian soldiers. Right now, we need help. We need help from countries who want to be in safety and democracy. Right now, we have food, we have water, we have medicine, but it will be over soon. After that, we're going to have a humanitarian catastrophe.
We are grateful for your understanding our difficult situations in our country, for our support. Thanks for everyone.
Good afternoon, dear friends. My name is Alexander Yazikov. I am a surgeon in Sumy Hospital. I appeal to you to support our country in our fighting with the Russian occupiers who are destroying our cities, destroying our hospitals, killing our people, killing our children. Unfortunately, we have a lack of medicines to help the wounded and to providing the needs of civilians. We all have high hopes for your humanitarian support. Slava Ukraini!
Thank you, Nicole. And now let me turn to our panel. These experts are directly involved with providing medical assistance to millions of affected Ukrainians. It is my pleasure to introduce Arsen Zhumadilov, CEO of the State Enterprise of Medical Procurement of Ukraine. Arsen is unable to join us for the same reasons that the physicians had to pre-record their messages. He is in the field doing everything he can to procure the medication. There is a small chance that his deputy will join us during the conversation. However, if not, we will take all the questions for them and we will pass them. In the meantime, given the emergency nature of this webinar, we also have a pre-recorded message from Arsen. And the rest of our panelists are going to be live, so please stay with us. It's not just the pre-recorded messages, but at this moment, Nicole, if you could play Arsen's introduction, that would be great.
Hi there. My name is Arsen Zhumadilov. I'm a Chief Executive Officer for the State Enterprise, the Medical Procurement of Ukraine. It is the central procurement agency under the Ministry of Health that focuses on supplies of medicines and medical devices. I'm now in Kiev's outskirts, suburbs, at one of Ukraine's largest warehouses that specializes on medicines, medical devices, and other goods of medical use. And I'd like to inform you that the stocks are being depleted very quickly. We all badly need medicines, medical devices, and other goods that are used now in hospitals to treat those who got injuries, that are used now by all those who are trying to provide first aid to those who got injured. As you know, the situation is dire, but we are staying strong, we are staying united, and we also need your help. Thank you.
Thank you, Nicole. And the next panelist is Katerina Babkina, an award-winning Ukrainian poet and writer, and now refugee who drove from shelled Kiev to city of Wrocław in Poland with her one-year-old daughter and her mother. Katerina has won several Ukrainian and international literary awards. At the latest count, her works have been translated into 10 languages, including Swedish and Vietnamese. I'm gonna introduce everyone and then ask them to give their perspective on the situation on the ground. describe the situation they're facing and outline the most pressing needs. After we're done with these introductions, we're gonna have a short Q&A with each participants with the questions that we anticipated are going to be asked by pretty much anyone, and then we turn to the audience Q&A. So, Katerina, please give us your perspective on the situation and tell us what is the most needed at the moment.
Hi, thank you for your interest to what is going on in Ukraine, though I guess it's not possible then that people and companies were not interested now in what is going on there, because what Russia does and what Putin does is the crime against the peace generally, against the, I don't know, against the humanity. So what's the present needs? It's difficult to say, though, as I have said here in Wrocław, after 4 days of staying at the Polish border in the car, because it's not so easy to get out from Ukraine now, though the countries that are bordering with Ukraine at the west are generally letting everybody in and also providing a lot of help just next to the border. You can find where to stay, what to eat, what to wear. You can buy some hygienic supplies or medical services and all. But of course, as everybody does, because this is the war, everybody from Ukraine is participating now. Whenever you are at Kyiv or Kharkiv with weapon, or somewhere abroad with your computer, you're volunteering, like doing logistics, connecting people, giving the information, translating and stuff. So from what I see, like trying to do the logistic between the European organizations and people and foundations in need in Kyiv, because before everything started, except for writing, I used to work at charitable platform, which is called Kind Challenge. And what we do is we provide verified payment methodics to Ukrainian NGOs and charitable foundation, which we check and confirm they are legal, and we monitor their help. So everybody who donates with us can get the information about where money had gone and stuff. So we are trying to involve as much people into charity as we can. And so together with our team, who is partly now in Berlin, partly in Ternopil, Ukraine, partly still in Kyiv, we are keeping doing what we did before, updating the needs of the foundations, because on Kind Challenge platform, we have now more than 100 Ukrainian foundations and NGOs. So we connected to them and updated their needs. And now we're trying to get help for them again, but now mostly among the people who are abroad. So you are welcome to check our platform and maybe find a way to help from there. But what I see from the request is that the medicaments and medical devices and the stuff you use in hospitals are in high need, because except for the people who are injured during the war conflict, there are still people who are fighting cancer, who are having their diseases, children are being born, people in hospice are still needing their medicaments and everything. And especially for those organizations which were supported by the foundations, it's a tough time now, because everybody normally donates either to the army or to the refugees, which is understandable. But still, there are cardio surgeries are still being done, and how do you say this? The children who are born before they should be, they are still there. They are still needed to be supported until they're able to exist independently. And so everything what we can say, because a lot of people voluntarily participate in buying weapons or different things like casks and ammunition. And people are also given shelter to people who flee from Ukraine, to the refugees. They are given foods. They are trying to provide some hygienic stuff that people need. But when it comes to medicaments, especially some not so, let's say, something prescribed from the general doctor. Sorry, I don't have enough of vocabulary to talk about this. And concerning what had happened, I realized that it's not about English. I just generally, even in Ukrainian, don't have enough of vocabulary to talk about this crime that is being done now towards Ukraine and the whole world generally. But nevertheless, I guess the medical devices and medicaments is now in a high need in Ukraine. And probably the second thing is support and possibility that people speak up, people from different countries, whenever they talk to medias or they go to the streets, but they make their government act, because Ukraine is super brave. If you have checked the size of Ukraine and the size of Russia, you can compare the possibilities of the armies and stuff, and we are keeping them at one place for a week already, which is a lot. Everybody participates in this war, and Ukrainians act as a heroic people, though I would never say this about Ukrainians before, even though I'm Ukrainian myself, but we need help. We need people to understand what's going on. We need people to stop saying like, I'm not taking sides. Yesterday I was connected at the air to the Fox News, and the reporter right before me told like, well, there are this and that sanctions towards Russia, and it's like not finally clear why people like the whole market should lose money and collapse, because people fuck the money, people are losing their lives in Ukraine. This is not a time when we can tolerate another point of view. There is not the time where we can not take sides, okay? What Putin does has to be stopped. What Russia does has to be stopped at any price. That's pretty much my statement and my situation now.
Thank you, Katerina. And your little daughter, who I'm just not going to name for security purposes, she provided a wonderful soundtrack to illustrate, the difficulty of the situation. Childcare is still there. Everybody needs to pay attention to that who has children. And nobody canceled the real life. Real life challenges are there, plus the war challenges. Anyways, we do have to move on, and it is my pleasure to introduce Dr. Graham Stewart, Head of Supply Chain Delivery and responsible person with Medicines Supply Branch of the Department of Health and Social Care. That's a mouthful. Graham is based in the UK, and he coordinated a large aid package to Ukraine within 2 days since Russian attack. 2 days. I barely could coordinate a webinar in 4 days with tremendous support. So I'm not sure how Graham did it, but logistics have been highlighted as main need, and we have logistics experts on the line. Graham, on to you.
Thanks, Hannah. First of all, I just need to make a small correction. I'm not actually a doctor. I'm a pharmacist by background. And I work within the UK's Department of Health. So I just need to make the statement up front that I'm here as an individual, and I'm not speaking on behalf of the UK government in any way. I also probably need to declare that I have family in Ukraine. So I have extended family in the center and in the east of Ukraine. So this is a very, very personal moment for me, and we're obviously worried about them. So, there wasn't an awful lot of pushing that needed to be done to get me to react to this. From a UK perspective, and this is me as a citizen rather than as a member of the government, the outpouring of support and the desire to help from across the entire UK, and that's in all 4 nations. I'm in England at the moment, but individuals in Scotland, Wales, and Northern Ireland have all reached out to me as part of my role and also as friends and individuals to express their support and their abhorrence at what is happening within Ukraine. So this is something that the entire UK nation is standing behind and desperately wants to help with.
Thank you, Graham. All right, next up, Pavlo Kovtoniuk, co-founder, Ukrainian Healthcare Center and former Deputy Minister of Health of Ukraine. Pavlo led a medical reform that introduced best practices to Ukraine, from e-prescribing to medical exams overhaul to restructuring of family medicine. Pavlo, go ahead, give us your perspective on the situation on the ground.
Thanks, Anna. First of all, I want to make a message that to everyone listening to us that Ukrainians are stay really strong against this aggression. 9 of 10 Ukrainians believe that we will win, we will withstand that. I think so too. However, there is a lot of things you can do to help us to do that, and I'm so glad to see that a lot of people in the world do that. Now, coming to the healthcare sector, if you allow me, I will use kind of 3 minutes of time to make a short overview of the most urgent needs we have and the ways you can help. I agree with Katerina that in such a situations, most people concentrate on kind of refugees and stuff like that, but there is still the civil sector and the ordinary needs of people, which are probably the most the area of the most attention to me and my team who are trying to volunteer and help. And we try to summarize what we think during the 7 days. Okay, it's a little bit messy here, but what works and what needs are more or less stable, so we can look at them. So the need number 1 is regarding military or territorial defense forces. They really badly need the tourniquets. They badly need the first aid kits. They need paramedic trauma backpacks. Ukrainians probably are number 1 purchasers for that in the world right now, but we need them more and more. Speaking of hospitals, dealing with civil population, the Ministry of Health is the player here. They, together with the medical procurement of Ukraine, have the list of priority needs for drugs. These are mostly the frequently utilized drugs and disposables. This list is regularly updated, and we have this list. We can share it with those of you who are interested to help. This area is more or less covered. As Arsene said earlier, yes, there is a bad need in many things, but still there is more or less organized process here, so we can share and we can contact you with the ministry. What are the areas of my own concern right now? And it's a little bit there is a little bit of lack of attention to these areas, is the chronic conditions and people who have chronic illnesses, and they are running fast of their medications. Mostly those are outpatient drugs, because the Ministry of Health is mainly concentrated on inpatient drugs. Those are delivered to hospitals. With outpatient drugs, first of all, the problems with access, but also there's problem with their availability. And mostly I'm speaking about these chronic conditions like diabetes. Insulin is really getting out of stock very fast here in Ukraine. I'm speaking of mental health drugs, which is very difficult to find now. And we are kind of every day have requests for that and do a lot of effort to find that. Orphan diseases treatment, chemotherapy for cancer patients, and supplies for hemodialysis. All of these types of drugs, there is some stock of those in the medical procurement of Ukraine warehouses, but they are running short very fast, and there is a trouble with new shipments. So this is a little bit thinking ahead, right? So maybe in a week or two, there will be a really dire situation with that. A separate problem is oxygen. Oxygen is all three plants producing oxygen in Ukraine. They stopped because this is a highly inflammable thing, and there is a very dangerous to continue producing it. So it can be solved with portable ventilators. Hospitals do that using ventilators they purchased during the COVID-19 pandemic, but again, they are running short. Now a little bit of information on how to help. Again, this is the list. I will share this slides later with you. These are the list of, it's not the exhaustive list of ways to do that, but this is what works for now, according to my experience during these days. So first of all, if you want to donate money, and I saw these questions in the Q&A already, there are a couple of ways to do that. One is to donate money directly to the Ministry of Health. They have a separate account for that, organized for them by the Red Cross. And there is a link in the memo. You can look at it and you can use it to donate money directly to the Ministry of Health. There are also a couple of good and trusted NGOs, US based. So that is more convenient probably for the you listening to us. One is Nova Ukraine, the other is Razom for Ukraine. So they have accounts in the US, and then they transfer that money to the needs on the ground here in Ukraine. The second way to help is deliver pharmaceuticals and medical supplies if you have them. And here I split into two groups. One is if you have large amounts of those, right? You are, for example, the manufacturer, or you are the distributor, right? You have large amounts of medical supplies. So you can do it two ways. One is medical procurement of Ukraine. Of course, this is a dedicated agency and the organizers have the contacts for that. And also you can do it via Ministry of Health, Red Cross. We can provide contacts on demand. If you are talking about medium and small amounts of those, for example, a company wants to donate something, or you purchase something and you want to donate, there are a couple of ways which are proven effective. One is Help Ukraine initiative, organized by Ukrainian logistic business. They work through warehouses outside, intermediary warehouses outside Ukraine and in the western part of Ukraine. The other one is 100% Life organization and the foundation SVOI. They work, the latter, they work mostly with military hospitals, also quite effective. So again, I will share that, and yeah, you can use that details to refer to. And the last thing to say is that there is also the way to help is the patient evacuation. So there are patients who are really sick, for example, people with cancer, and some organizations organize their evacuation to the clinics abroad. There is quite a well-organized process now to evacuate kids with cancer. And there are three foundations, three NGOs, which are listed here, who do that. Some of them work through American hospitals who coordinate this help. One of them is St. Jude's Hospital in Canada. This hospital has a lot of contacts in the hospitals in Europe, right? So, and it works as a coordinating hub. So they receive the need, and they found a place in Europe, and then they evacuate the kid to that hospital. So possibly we can create more hubs like that. And also recently today, actually, the Ministry of Health opened the possibility for the medical practitioners to come to Ukraine from abroad and to help deliver medical services here. I have the link here to register. So every medic, paramedic, nurse, medical doctor can register here if he or she is willing to come to Ukraine or to the neighboring countries to receive refugees and help. You can do that. So in short, these are the most urgent needs. Again, I will share them. I will share this this memo with organizers. Yeah, over, Anna.
Thank you. Thank you, Pavlo, and thank you for such a detailed list. People are always asking about these. Quick note to all the participants, including myself, let's try to speed up a little bit. We have a lot of content to go through, but with this, I'm turning to Dr. Zahorodny. Maxim Zahorodny, please introduce yourself.
Yes, my name is Maxim Zahorodny. I'm PhD. I'm associate professor of National Bogomolets Medical University. I also work in International Medical University, European Medical University. It's my part of studying teacher part. Another part, I'm a practical cardiologist, and I work in the small clinic in Kiev. And it's short information about me. And actually, what I'd like to tell you, the first is because Anna asks sometimes regarding our feeling, our feeling of this situation, because frankly speaking, when I was told a month ago that in a month we'll have the war against the Russia fight against Ukraine, it sounds like absolutely some fantastic information. And now today's with the when from 5 till 10 times a day we hear this sounds of air alert sounds, and we need to go to our our how to say defending parts of our building to hide, and actually it's absolutely strange, so I can say strange situation, and it's in one part, and from another part during this 5-8 days I see how big hearts are in our people, because people's help to each others, because it looks like absolutely miracle this to see the people we live near each other for long years, and only now we feels like sisters and brothers, so helps each other, and it's absolutely great. And this is regarding the feeling for the medicine situation. You see the city, of course we hear here in Kiev this the sounds of explosion, where somewhere inside town, city, inside the city, somewhere outside, but the situation is stable, so our defense, Ukrainian defense, our soldiers protect Kiev from bombs and from explosions inside city. The main part of them are protected, but I understand that now is a war, and the situation may be changed very quickly in 1 or 2 days. You understand? Yes, and so that is why we need some medication, because some drugs we need it badly, because in Kiev and in all our cities there are a big queues to the pharmacies. The people take medication because they actually don't know what to buy, but they buy as much as possible. So that is why the situation with medication is quite serious. It's the same information tells you Katerina and Pavlo, and I need some time to prepare the list of medication which may be help for our in Kiev. And also, Anna, you tell me where I can send this list of this medication, and how to do it technically. Yes.
Yeah.
And also the information for I'm the member of the charity foundation. We are create some months ago the charity foundation to help children, to help all old people in different situations during our lives. And of course, now, due to the last 8 days, you understand, the need of this help increase. And of course, what I told you that we don't know what will be in the future days. So that is why the need of the help may increase very high. And of course, this is the war. And so this information. So my question is, how can I send the information regarding the drugs? Which drugs are we waiting for due to our situation in Kyiv? And I also send you the information for this foundation. So maybe someone maybe help who want to help us may send some money and for our situation.
Thank you, Dr. Zagorodny. I will pick up with you offline, and we'll definitely disseminate your list and information about your charitable foundation. Thank you. Thank you for joining and for the introduction. Now, I would like to ask sort of a blitz quick round of questions for all of us, and we'll turn to Q&A. Katerina, the first question is going to be for you, and I only have one question. Not a medical perspective, just a real person perspective. If you could send a message to all Russian mothers, what would it be?
Get your sons back now. Like, it's kind of too late to tell them you're guys zombied by your government and things are not that you think probably, but Russia had lost for 1 week only like approximately 5,000 people. It's a lot. And normally Russian mothers are considering their sons, girls, their boyfriends, and everything, like staying at somewhere practicing, you know, maybe in Crimea or so, which is not so. So the first message I would send them would be try to get your sons back. And the second is go to the streets now. Your country and your future also depends on what is going on in Ukraine. And it's actually the message to all the Russian people, not only to mothers or not mothers. Go to the streets, try to stop this from inside. Stop lying yourself. Stop Putin because he's doing a crime against the humanity now.
Yeah, and against their own sons. Not that anybody needed my comment. Thank you, Katerina. Thank you. This is the sentiment I keep on hearing consistently. All right, more turning on to medical needs. Arsene, Graham, this is question, I'm sorry, Arsene is not on the line. Pavlo, Graham, this and Maxim, this question is for you guys. What is the biggest misunderstanding about medical needs during the war? What do people provide that you don't really need as opposed to what you need? Go ahead, and please remember, we are running out of time, so quick answers.
Absolutely. Okay, I'll dive in on this one because I'm probably the one that's got the most experience of war scenarios. And I have seen in many cases inadvertent aid that is sent on purely good intentions, but is completely inappropriate for the country that it's going into. And all that does is it consumes a logistic resource, which is better needed in other areas. Things like products which are out of date, for example, completely inappropriate. Products that aren't close to what is currently being used within the country that they're going to, which just slow down the clinical decision process, and they just increase risk from a clinical delivery perspective. And products that, frankly, have been transported inappropriately, thrown in the back of a container, sent to a hot country, and have just been cooked in transport. So absolutely, we need to be conscious of the logistics of getting these products to Ukraine and making sure that the products that we are sending are absolutely the right products that are needed. The other bits that I was just going to add in, Anna, if I could, is we also need to be conscious of the phase of the conflict. In the very early days, and I can see this happening in Eastern Ukraine, the main focus is in trauma, but we cannot forget the western part of Ukraine where trauma is not the focus. As Pavlo says and Maxime say, you know, these are normal conditions which still need to be treated. The population is still there. So the breadth of demand and the breadth of products that are required is incredibly wide, but we need to make sure that we're sending stuff that is actually needed, not just stuff that we think we can throw in the back of a van and take across.
Thank you for this very clear and direct explanation, Graham. And for this, I do want to draw everybody's attention. There is a list of needs. Please email us at emergency.aid.medzakupivli@gmail.com. We will triage your inquiries and tell you what's needed. All right, next question. It is my understanding that supplies are more needed than money. Is this correct? Pavlo, Maxim, what are you guys seeing in the field?
Yes, regarding the first is the situation, to answer your question. The first, I think, is the logistic problem because of the war. You understand it. I don't need to explain this because the same situation is for bread and for drugs and medication, the same problem. The next situation is the psychological action of war. When we are inside this war, the people, when they go, for example, for pharmacy, they try to buy as much as possible, not because they need this medication, but because they are frightened, they fear, and this fear they try to buy the medication. That is why is the problem of so-called empty shelves in the pharmacies because of this. So that is why, and so why we ask that when the doctors receive this medication, we prescribe these drugs directly to those who need this medication. So that's why we can avoid the second problem. And also also when we have this medication, this may help us with the logistic question for possible absence of medication. This is what I can answer for your question.
Thank you. Pavlo, anything you have to add to this?
Yes, I agree with Maxim that right now, at the very onset of this invasion, the logistics is the main problem because the green corridors are not organized, and mostly you have money, but you cannot procure, for example, the first aid kits or insulin or whatever. But if you look a little bit ahead, if you look 2-3 weeks ahead, you will need money, right? Because you need to think of continuous supplies, and you need to start with procurement right now in order to have drugs in 2-3 weeks or a month. So I don't want to discourage people not to donate funds. So you need both. Right now it's more about logistics, but tomorrow it will be more about funds. So please do both if you can.
Thank you. Well, it dovetails very nicely to my next question. Logistics remains a challenge. What do people need to keep in mind when they plan and organize shipments? And everybody's free to comment, but I'd call on Graham right now. One thing we never mentioned is that Graham has 23 years of experience with the British Army, and he's seen combat situations in all the hotspots: Bosnia, Afghanistan, Iraq. So Graham has plenty of experience in this area. What can you tell us about it, Graham?
Yeah, I think putting the combat and the conflict experience to one side, if I focus on what we're doing currently to move stuff to Ukraine and some of the challenges that are around that, it might help to just manage people's expectations. So at the moment, we've assembled large quantities of goods, and those are being flown from the UK into countries aligned or alongside Ukraine and moved across the border through those green routes. One of the big problems is just the sheer volumes that we're talking about and getting enough space on airframes. So what if I could offer one piece of advice to anyone, and this is what I'm saying to the pharmaceutical industry in the UK, is if there are manufacturing sites that are being used on the European mainland to produce products, it makes an awful lot more logistic sense to move directly from those manufacturing sites rather than bringing it back into the purchasing country and then shipping it back out. So piece of advice, move it from the area or from the location that's closest to Ukraine. That will reduce the logistic footprint, but it'll also mean that the products are far better assured when they arrive to be in the right fit condition to be used.
Mm-hmm.
Thank you, Graham. Well, I'm looking through the list of my questions. This is very much on the fly, so I appreciate everybody's patience with the sort of emergency last-minute need of this session. So we talked quite a bit about chronic conditions or non-war related emergency needs. So as we said, nobody canceled COVID, cancer, and childbirth. Pavlo, if you have it at this time, and I realize you may not have created it in the past 8 days, but if you have it, what is your strategy on managing long-term conditions and planned medical care that cannot be postponed at this time?
Yes, Anna, you're absolutely right. There is this, again, as I said, there is a little bit this forgotten things, right, in all this emergency, and this is that people need regular medical services, mostly in the cities which are under attack right now. People cannot leave their homes, so they cannot have medical consultation or the treatment. Also, the Russians, they are shelling hospitals. There are 15 cases of that, including 2 cases in maternity hospitals, and that's a big thing. The Ministry of Health and the local authorities do their best to maintain the services, and currently it's more or less under control. Kids are being born, services are more or less provided. However, what I am really concerned, and I mentioned that, there are kind of disadvantaged populations, people with really serious chronic conditions, like mental health patients. They're kind of a little bit forgotten here, and they are getting very fast out of their medications, and without medication, we just can't really survive. Or, for example, HIV treatment, right? There are some NGOs working with that, or hemodialysis, right? People just need to go here and there all the time. So these are real challenges, and I am currently trying to put all my efforts in there. There is no, honestly speaking, there is no organized way to do that, but we are struggling to do that. And probably what you all can do, who is listening to us, is to help with supplies, right? Both with funds and with medications and disposables.
Thank you, Pavlo. Well, I think we made it very clear to everybody sort of about what are the tangible needs. A little bit less tangible. We also have a very, very strong response and outreach from various telehealth organizations, including mental health, which is well covered by telehealth capabilities here in the US. Pavlo, how can they help? Who can they get in touch with?
Cool. I don't have a direct answer to that, right? I hope I will have it soon. What is the situation right now? There is a dispersed group of medical professionals or NGOs trying to organize the online consultations. There is no kind of one place you can go for that, but there are multiple initiatives. For example, there is a community of psychologists or community of family physicians, or here and there, people are trying to do what they can. Because medical doctors, for example, from the western part of Ukraine, they have this time and they are willing to do that. However, it's not organized right now at all. This is number one. Second is there is also the kind of willingness from abroad, from doctors abroad to do that. However, the language issue steps in, right?
Yeah.
Speaking of the solutions, I think, honestly speaking, that current people just can use their ordinary software solutions, like speaking through WhatsApp or whatever,
Yeah.
and that will be perfectly enough. We don't need right now in this emergency, we don't need recording of that or adding that to their medical records or that whatever. It just contact with a medical physician. For example, if you move from one insulin to the other insulin, because this is what you have, you need a consultation of your endocrinologist. You don't care about making the medical record on that. So with solutions, I think it's not that urgent. It's more urgent about organization, and probably the ministry should work with that. But I would appreciate it if you will kind of list of contacts of the companies that are willing to help. So maybe very soon we will have more articulated demand for that, and I'll be happy to reach to you with it.
Yes, we are triaging all inbound inquiries and sort of collecting them at this point. We're trying to react as fast as we can, but we all understand that time is running out fast, but we'll get to everybody who offered their help, and we'll pass their contacts to Pavlo and other colleagues as needed. We only have 5 minutes left, so I'll ask for brief answers. Dr. Zahorodny, do you have anything to add to Pavlo's answer about telehealth capabilities?
I don't have anything to add because Pavlo is absolutely full and completed answer for this question, because absolutely right. I don't need to repeat, waste the time. So actually, everything is clear. So what, if I correctly understand, Anna, so I create, for example, because what you told regarding some future medication, because I create the list of medication, it's not emergency medication just for this moment, it's medication for to treat people, to have to prescribe them for months, for example, antihypertensive drugs or some the situation. So that is why it's will be very nice when I create this list, and I can contact with you and send you the list, and not to waste the time, because actually Pavlo is absolutely clear. I could not add nothing for him, for his speech and for his information.
Okay, thank you. In the remaining 4 minutes, I have 2 questions and closing remarks. So, Graham, again, based on your vast experience, we talked about the things to do, what's needed, all of that. What are the things not to do? And you covered already, don't send old stuff, don't send expired stuff. Anything else? Any security precautions that you can advise on?
Yeah, absolutely. So I think given our knowledge of how let's just say the other actors in this on this stage, given our knowledge of how they operate, it wouldn't be unusual to expect them to potentially generate spurious demands, and then have the various logistic ports and airports blocked up with uncollected consignments. That I think is a big risk. So I would suggest that we only use validated contacts. I know that the state enterprise, and Anna and I have spoken, and Arsen, we're absolutely sure that we have a fully legitimized communication route. Just be very, very wary of taking requests or needs from anyone outside of the organizations that have been published here. Otherwise, we do run the risk of potentially having some inadvertent diversions put in place.
Thank you, Graham. And the last question, well, actually, let's skip that last question. All right. We are at the top of an hour. For those of you that are still on the line, I have a big ask. Pharma and medical devices representatives who are on the line, please get in touch with us or with the authorities directly. Coordination is absolutely key, and you will save many more lives if you reach out to us directly so we can put you in touch or share with you the list of needed things. Thank you. Please remember that we are saving lives this time. All right, so I want to thank once again our panelists, Health and LinkedIn team, and of course our volunteers who behind the scenes helped us to put this webinar. Before we disconnect, I would like to note that there have been several reports of criminals impersonating well-known charities, such as Save the Life, as well as at least one report of scam. Please keep that in mind when donating. Thank you, and Slava Ukraini.